from the station that's on your side. This is Channel 7 News Daybreak.
The flu widespread across the U.S. in one of the worst seasons in nearly the past decade. Arkansas hit particularly hard here. Now, we've got a lot of questions from our viewers over the last weeks. Is the flu shot helping more than what you might be hearing? Joining us this morning with the latest information to help keep you safe and healthy is Baptist Health Dr. David Gerson with Sherwood Family Medical Center. Thanks for coming in this morning. We run stories almost every night, I think, at this point. I'm sure you've gotten a lot of questions and a lot of patients in with the flu or flu-like symptoms asking about it. So let's talk about effectiveness. What are we talking about here percentage-wise? I've heard 10, 15%, upwards of 30.
So a lot of the news reports are about 10% effectiveness, but that's actually not accurate. That's from an Australian study.
So not here. Okay.
No. So here it's about 30 to 40% effective.
That's much better.
Still not great, but a lot better than 10%.
Sure, exactly. Right. Okay, so that's good news.
Yeah.
Now, when we talk about, though, latest information available, how many cases are you seeing, are you guys seeing in your office, maybe on a weekly basis right now?
Sure. Well, I would just tell you, for me personally, it's probably about a third to a half of my appointments just in the last 3 weeks are something to do with the flu or some other respiratory or other illness that people are thinking is the flu.
Okay.
So yeah, we still want you, even if it's not the flu, if you're having respiratory symptoms, sinus symptoms, fever, body, we still want you to come in and check you out, because sometimes it can be subtle and you do have the flu and we can do something about it if you get in time.
Still giving flu shots out?
Absolutely. We want to, the flu season runs certainly through March, and in my experience, it's run even as late as May in Arkansas, and so it's not too late to get a flu shot. The other really important thing to remember about the flu shot is it takes about 2 weeks to become effective. Okay. So I give you the flu shot today, in a couple days you feel body aches, 102 fever, and cough. Don't think to yourself, I've got a flu shot, it's not the flu. It's the flu. And so you still have time to get it, and we want you to get it now if it's available at your doctor's office or the local pharmacy.
And don't think that the flu shot gave you the flu. It's literally impossible.
Correct.
Now, one thing I do want to talk to you about, though, is people asking, do I need to get a second one if I got it back in September or October, early in the flu season?
Absolutely. No, you do not. If you're an adult and you've had the flu shot before, you do not need a second booster. We actually see that the flu shot you get in September very often is actually good through July or August of the following year. If you're a pediatric patient, if you're under the age of 9 and you've never had a flu shot, then yes, you want to. It's a 2-part shot series, one on day 1 and then 4 weeks later, so September 1st, October 1st kind of thing, or right now January, what is today, the 17th, February 17th. But that's only if you haven't had a flu shot and you're under the age of 9. Otherwise, there's no booster necessary if you've had the flu shot.
Okay, and then it's 6 months too is the minimum age to get a flu shot for an infant, correct?
And for infants and for pregnant women, we want pregnant women to get a flu shot as well.
Okay, and now if an infant, so like right now, if an infant turns 6 months, right now you'd recommend them going to get one. Okay, and then you mentioned the 2-part series, that would be a part of that too.
That's a 2-part series.
Okay, good to know. All right, anything else about the flu you want people to know? I mean, obviously prevention is pretty simple, right?
Prevention, washing your hands and lots of fluids. And listen, if you're sick, stay home. Keep your child home. Don't try to rough it and go to work or go to school, because you're just going to get other people sick. And you yourself are not going to get well. You're going to get sicker by not letting yourself rest and do what's necessary at home.
Okay. Thank you so much for coming in this morning, as always. I know you probably have a lot of appointments to get to today. Baptist Health Helpline on your screen, 1-888-BAPTIST is the number.